There are three general types of bleeding: capillary, where the blood oozes slowly from a wound; venous, where blood flows steadily from a wound; and arterial, where blood spurts from a wound. There are several types of open wounds: abrasions, lacerations, incisions, punctures, and avulsions. Regardless of the type of bleeding or type of open wound, follow the same basic steps to control bleeding. Minor wounds can be cleaned with soap and water to prevent infection. Flush the wound with running water. Apply an antibiotic ointment and cover the wound. Seek medical attention for wounds, such as puncture wounds, that have a higher risk of infection. For more serious wounds, place a dressing over the wound and apply pressure. This action stops most bleeding in a few minutes. With a dressing covering the wound, apply a pressure bandage to maintain pressure. Wrap a roller gauze bandage in a spiral pattern snugly over the area, but don't apply it so tightly that it cuts off circulation. If blood soaks through the dressing and bandage, apply another dressing and bandage on top of the first one. Call 911 if bleeding cannot be controlled. Amputations are injuries where a body part is cut off. Control the bleeding and care for shock. Recover the amputated part and wrap it in a dry, sterile gauze pad or clean cloth. Place it in a plastic bag or other waterproof container. Keep the part cool if possible, but do not freeze it. Impaled objects come in different shapes and sizes. Leave an impaled object in place and hold it steady to avoid movement. Whenever possible, use bulky dressings to surround and stabilize the object. Bandage the object with dressings in place and seek medical attention. Internal bleeding occurs when a blunt object does not break the skin, but it does cause blood vessel and tissue injury that results in characteristic bruising and tenderness. To care for minor internal bleeding, apply an ice pack for about 20 minutes and then an elastic bandage for 2 to 3 hours. Repeat this process for 24 hours. For more serious internal bleeding, call 911.